I'm reading these stories here, and I just cannot understand, why, communities, why hospitals would choose to close, primary care, family medicine residency programs. Of course, it costs a lot of money. And of course, they are probably close to being at the top of the list because, they don't bring in the dollars that procedural specialties do. People like, surgeons and people that cut things and do a lot of different type of procedures or brings in research or this and that. But just like in any community, primary care, family medicine is the basis for all care in the community. It is where people go. It is where people go to get their care. Especially, those, low-income residents, those residents who have nowhere else to go. Family medicine, primary care takes them in, takes care of these patients for those, communities striving towards patient-centered medical home, a team approach, team-based care, preventative care to prevent those very expensive ER visits, to prevent those very expensive hospitalizations. You get those patients, plugged in with the right primary care physician, with the right family physician, then it will be cheaper for the community. It will be cheaper for the hospital. It'll be better care. It'll be better satisfaction for patients, for providers, for physicians, for the community. That's why you need to keep this residency program open. And what usually happens is that the doctors that train at this hospital, at this medical center, in this community, they'll probably stay there. They'll probably stay there and continue to care for the community. You'll have continuity. You'll have people who are familiar with the community resources. You'll have people who are familiar and invested and have a buy-in in the community. That's why you want to keep this residency program there. Now, it's really coming down to dollars and cents. It's really coming down to the bean counters and saying, hey, we cannot afford to keep this program open. But how can you afford not to keep it open? Just like it's been said numerous times by the leadership out there, by physicians, by the community, closing primary care programs, or even a community setting like this, having primary care leave the area, all you're doing is setting up your community. All you're doing is setting up those patients to come in later in their disease process, to come to the hospital, to be admitted. That's expensive. Or even to go to the emergency room for their primary care, which is the most expensive care out there. Why not just keep this program open? Why not keep those doctors there? Why not keep those primary care family physicians there? Because they're going to stay in the community. They're going to continue to give care to the citizens of your community. It's going to be cheaper. It's going to be more satisfying for the patients, for the providers, for the community. That's why you should keep this open. I encourage my friends out there in California to keep fighting for this program. And unfortunately, with the state of our national economy, with the state of state economies, that we're going to be seeing more stories like this across the country of primary care, of family medicine residency programs closing because hospitals and hospital systems cannot keep them open because they said it's too expensive. But the unintended consequences of something like this will be that care in the community will get more expensive. It will lower the quality of care in your community. That is what is going to happen if you close these residency programs that are out there. Don't be short-sighted in this, kids. We're in this for the long term. I really believe that family medicine, has the solutions to help this broken healthcare system. I encourage my friends out there in California to keep fighting for this. I encourage my friends across the country, family medicine advocates out there, continue to speak up for your patients. Continue to speak up for your specialty. Because really, when it comes down to it, if we don't do it for our patients, then who will? Who will? So I will continue to talk about this and continue my friends in the family medicine community to talk about this, because we have to keep this message going here. We have to keep talking about the importance of family medicine, the importance of primary care, why we think it is important, why we think that we have the solutions to help with this broken healthcare system. And I think we're going to do it. I have faith. I am optimistic that we could do that. We'll be right back, and I will continue onward on this Sunday night here on the Family Medicine Rocks podcast. My name is Mike Savella. We'll be right back.